safety of the people, I think the American government has the right to do whatever.
There's laws in place, they need to be enforced.
Every year, my insurance payments, my premiums go up.
Something's got to be done because there's a lot of people running around without health care.
Obviously, there's a lot of debate as to whether illegal aliens are a positive influence on this economy.
It's hard for us to afford everything the way it is, and then for us to have all kinds of other people to support.
But we are a country of the free, and so I think we have to be very open-minded.
I just think proper education, learning the right things.
When I look on television and I see 3 separate shooting incidents,
I think they need to get tough with it.
Straighten out the politicians.
Keep to their word and to be honest. I think that's important.
They make a lot of decisions which sort of impact my life, impact the children's lives.
I think it's an obligation to vote. I think we all need to do that.
Welcome everyone, I'm Tom Overley. KSMQ in partnership with KTTC is pleased to present to you Election 2006, a series of conversations designed to aid you in voting in November. Our coverage represents a sampling of key races from throughout this region. It is KSMQ's plan to continue to build upon this important service by providing even more opportunities to get to know and to understand the issues at hand and the people who will represent you in Washington, St. Paul, your region, and your own hometown. We are joined by Republican candidates Mrs. Brenda Johnson, Independent candidate Kevin Kelleher, and Democrat candidate Mrs. Sharon Erickson Ropes. They are all vying to represent you as state senator in District 31. I'll be asking questions compiled from our election team, but also questions submitted from you, the voters. None of the candidates has been provided with these questions beforehand, so let us move right into the first question. Thank you for joining us, first of all.
Thank you, Tom.
The 3 of you are competing for a Senate seat currently held by Bob Kierlin. What previous experience makes you an adequate candidate for a state senator? And we'll begin with Brenda.
Well, thank you very much. In addition to being on City Council for City of Chatfield for the last 8.5 years, I've gone beyond that duty quite a bit. I've served on numerous statewide boards and commissions, and those are on my website, so I won't list all of that, brendajohnson.org. But I think that the key thing that voters need to know is that my background is also working very regional. In Southeast Minnesota, there's a regional group called the Southeast Minnesota League. It started out years ago as a 3-county area, Winona County, Houston County, and Fillmore County communities working together. And after I became a council member for City of Chatfield, I got introduced to this group. Thought it was a great idea to have elected officials learning from one another, but I also felt they should do more by working regionally with our legislators. So I put that idea forward to them, and they said, "That's a great idea, Brenda. We want you to help us move this idea forward, and we want you to be our president." And so here I am, a brand new elected official, learning from them, but also now in a leadership role. And we took that idea and moved it forward in ways that were rather unexpected, in that it not only worked well, it worked very well. Legislators appreciated getting a consistent message from communities all throughout Southeast Minnesota. And we would do it in a very simple format of a single sheet of paper, so legislators would feel like, wow, this is really doable. We can achieve these things instead of getting a huge stack of materials. And the communities in adjacent areas said, we'd like to join you, we'd like to join you. And so we grew from a 3-county area to a 6 and then an 8-county area, including additional legislators from those areas as well. So we worked across party lines. It was nonpartisan, it was grassroots. We didn't have staff. We had Brenda Johnson, I'm a teacher, and an economist.
So how long have you been a teacher, really quickly?
16 years.
16 years.
16 years.
Okay. Kevin, I want to ask you the very same question. What kind of experience would make you a good candidate?
Well, Tom, thank you for the question. I've been a Houston County Commissioner for 16 years. And in that time, I've served my community in a variety of ways, and I did that prior to that as well. I have been appointed by 4 governors, 2 Republicans, a Democrat, and an independent to state-level committees, all the way from wetland preservation to welfare reform. I'm past president of the State Association of Counties, and I'm the only county commissioner to have served in the chair of 2 policy committees for that organization, Human Services and Environment and Natural Resources. I also serve on the National Board of Directors of Counties, and I serve on the Agriculture and Rural Affairs Committee there, the Rural Action Caucus. I've been a public school administrator. I am the vice president of a mental health center in Winona, have been on that board for 14 years, and I'm also one of the founding members of the Center for Rural Policy and Development. And that group is a research group that provides research and data to rural legislators so that they can make informed decisions. I've been involved in this arena for some time.
A lot of leadership roles.
Correct.
Okay, Kevin, thank you very much, and Sharon.
Thank you, Tom. My two areas of expertise are basically in healthcare and education, although I have lots of experience in local, regional, and state level leadership. I'm a former Navy officer. I served in the Navy for 5 years, and I was twice elected school board chair in Winona. So that's one of the largest employers in the Winona area. I've worked with $30 million budgets, and that's nothing compared to the state budget, but it certainly gives me a good training ground for large budgets and dealing with large numbers of employees. Currently, I'm the state president of the largest child advocacy organization in Minnesota. So I serve a group of people that has more members in it than the entire southeastern Minnesota district combined outside of the Winona area. So I'm used to serving and dealing with lots of members and constituent groups. As the state PTA president, I sit on many state level boards. I've sat on other boards outside of education. So I do have quite a bit of state level experience. I'm a state level veterans advocate, a state level education leader, and a state leader in healthcare issues. I've been appointed to the Attorney General's Patient Rights Task Force, and I bring a lot to the table in terms of being ready to run as a state leader already.
So speaking of education, with this recent spur of school violence across the nation, what is the best way to keep our kids safe in school? Why don't we
most schools already have programs in place, and I think that's an excellent thing. They're making sure that students understand what's appropriate to bring to school, but also they're making sure that doors are locked, quite
Even
frankly.
in small schools?
Yes, they are. They're making sure that if there's an entry point to the school, it is where there's a faculty and staff right there so that they know who's going in and out of the building. And it's not a perfect world we live in, but I think it's a great thing that they're taking action on this and being proactive. They're making steps that I think it's surprising for folks that we have to do that even in small towns, but we do it.
Right, Kevin?
Well, the fact of the matter is, Tom, unfortunately, if someone's bent on doing destruction, they will do it, whether it's in the school or outside. And I believe that what we need to do is focus on prevention. And that's why I'm a founding member of the Family Service Collaborative in Houston County, where we have put social worker in the school, in each of the schools, to do preventative work. I'm also, as I said, on the board and a vice president of the Mental Health Center in Winona, and many of these people have mental health issues. You have to do that kind of damage, and so we need to get out in front and prevent some of these people from becoming as damaged as they are to do those horrendous acts.
Sure.
Thank you. Good question. I am a former school board member from Winona, so we have been dealing directly with that issue. Again, it's an access issue. As Brenda mentioned, locking the doors. I think most school districts have taken some fundamental basic security approaches. We do have to keep in mind that we need to educate the families and the communities about what's appropriate. Certainly preventing guns from entering schools, is a top priority. However, I also agree with Kevin. If somebody is determined to hurt someone, I have said this as a school board chair in Winona, we cannot guarantee people that their children are going to be 100% safe in school. We can take practical steps to make sure that we're reducing opportunities, and then also seeking out and making sure the kids in schools have counseling. I'm very concerned because our counseling staff across the state has been cut dramatically as schools are underfunded from the state level. So we do
more funding for
absolutely counseling. Yeah. And again, I've been a head nurse of a psychiatric unit, so I've done a fair amount of family counseling myself. We do need those support systems in place.
Let's talk about school vouchers. Is the school voucher program appropriate for Minnesota, Kevin?
I don't believe so, Tom. I'm opposed to vouchers, quite frankly. The public school system needs to be whole. And in that, I mean, and I support private schools. I think everybody should have a choice as to what school they want to send their children to. However, if there's an issue with the private school, the public school is always the place of last resort, and it always will be. And so we have to make sure that that continues to be whole. There's many things we can do to improve our current situation. One of them is equalized funding. Currently, every school in southeastern Minnesota, those students are funded at approximately $4,000 less per student than the Minneapolis and St. Paul school districts.
Yeah.
Yep, and they have special issues, I understand that, but not $4,000 a student. We have to get our fair share.
Sure.
Yeah.
Brenda?
Well, that's one of the things that has been a main feature of my campaign is the idea of working towards fair funding. All along I-90 now, legislators want to work together because they've seen the activity we've done here in southeast Minnesota, getting communities and legislators to work together. So when we think about the overall funding issue for schools, we do have a shortfall for many of our districts as far as how much funding do they get per student. And you're right, it's $3,000, $4,000, sometimes close to $5,000 per student. And the question, though, is how do we fix that? I mean, we can talk about the problems and the issues, and if we don't have a plan for fixing it, then we're left flat. We're left with the same list 4 years from now that we have today of things to do. And the thing to do with this is knowing how to work regionally. We need to have legislators in our district who work with legislators in other districts. You can't do it one legislator at a time anymore, especially not since we've had redistricting in 2002 and we've lost some of those rural legislative seats. Every single one of our rural legislative seat votes is more important than ever. And they need to be leveraged, they need to be working together as much as possible on regional issues. And I see school funding, our per pupil school funding is one of those things. Regarding the school voucher question, I too support choice. I think parents should be able to choose where their kids go to school and the dollars should go with them.
Okay,
but the overall funding is the key.
Okay.
Yes, I believe the question was on vouchers. And I'm a firm believer that public schools are funded by public dollars and they need to be maintained within that domain. I'm private school educated and public school educated, so I see there's value in many systems. And as a school board member in Winona, as we're faced with continuing declining enrollment, some of our rural, very small schools were challenged with being closed. I supported those schools until the very end. And then when it became obvious that the school board was going to close them, I helped transition them to, help transition them to charter schools, which are non-traditional public schools. And so I believe that public funding needs to go to public schools in the same way that we're dealing with the common good here. If everyone fractures off, and you put this in terms of police force, let's say, everyone who can afford to live in a gated community and hire their own private security guards, would move here, and then the public police force and public safety would be at risk. It's the same concept with public education. We need an opportunity to provide public education for the common good.
We have so many issues and topics we want to cover here, so I appreciate your responses. Let's move on to another hot topic for this area. Should illegal immigrants in Minnesota be allowed to pay in-state tuition for state universities and colleges?
I've taken a position on that frankly, I think that we don't need to offer an extra bonus or incentive for additional illegal immigrants. I'm all for immigration, but I want it to be legal. And frankly, I think with the current situation of students who are already here, who are legal residents here, not being able to afford to go to school sometimes, we need to look at how do we make it more affordable for them first.
Right.
And frankly, we also need to look at if we're going to, as we increase our funding for higher ed, I'd like to see some of those dollars go to direct tuition, financial aid improvements for our current students. In other words, if we've got money that we can put into higher ed, I'd like to see those dollars go directly to students who have financial aid.
Right. Okay.
Financial aid needs. You bet.
Kevin?
Well, I would agree with Brenda. The terminology illegal alien immediately would tell you that they're here illegally.
Or undocumented workers.
Yeah, so it befuddles me that we would be paying for them to be educated. It is a very big issue, and the Center for Rural Policy and Development that I talked about, and I'm a founding member, we've done a number of studies on the Latino workforce and illegal aliens. And frankly, it's a problem that impacts business a great deal as well, not only education, because some businesses are competing with other businesses who hire illegal aliens, pay them a mere pittance, put them at risk, quite frankly, and so that it becomes an uneven playing field. And I think we also have to focus on the businesses who hire them. It's not just the people who are coming here for the job, it's the people who hire them. They're also contributing to the cost of education for those people.
They're
so
part of the responsibility.
You have to look
in
at
this.
the whole system in order to cure the problem.
Sharon.
First, it's a federal issue dealing with illegal aliens, and we certainly need to deal with our borders and deal with the fact that we do have millions of illegals in Minnesota or in the nation. As far as allowing their children to be able to go to school at reduced rates, or it just doesn't set well, I think, with most people. We want to be fair in Minnesota. And being fair, I think, is dealing with the whole affordability issue for all students, whether they're Minnesota students, Wisconsin students. We certainly welcome Wisconsin kids even into our systems. The best thing that we can do is make serious investments in higher education. The tuition costs in Winona, where there's several higher ed institutions, has gone up about 70% in the last 3 years. That is keeping a lot of our homegrown kids right out of the college opportunities. So we have to make sure to invest in higher ed so that cost is never a barrier for any student who wants to go on to school. It's an opportunity situation. It's a fairness issue for Minnesota.
In this conversation, we want to give each of the candidates a chance to ask a question to one of their opponents. And we'll start with Brenda. What is a question that you'd like to pose to one of your opponents in this race?
All right. Well, I'll start with Sharon. And your healthcare, education, and other proposals will require tax increases. You've not really stated how you would fund these proposals, other than saying that the healthcare administrative cost reductions would cover the healthcare transition you'd like to see to a single payer plan. However, those administrative cost reductions really have not occurred in other countries that use similar type plans. So how would you be raising taxes, and who would you be asking to pay? I know in your school board service that you've had situations where there were unfunded liabilities created that created later difficulties, and so I want to make sure that we're knowing where these taxes will come from.
Okay, a brief response.
Okay, thank you. And actually, the fact is, Brenda, that the majority of the cost in bringing affordable health care to every single Minnesotan would be derived from the administrative waste savings. That's been clearly documented in many, many studies, and that we could save billions of dollars. I'll give you one example. If we went to a statewide pool, an insurance pool, we could spread the risk across the state of Minnesota, reduce down our costs by millions of dollars, and be able to roll those savings into additional coverage. So there's many strategies for reducing costs, and actually by streamlining the system, broadening the risk, negotiating down our drug care and health care costs would be enough, in fact, to cover the system.
Do you outline some of these on your website as well?
Some are on the website, and some are in publications that I'm getting out to people.
So for more information, people
Absolutely.
can
ropesforsenate.com.
Okay, Kevin, do you have a question for an opponent? We're running out of
That's
time.
okay.
Sorry
That's
to say.
okay.
Sure. Both my opponents have stated that they are taking money from political action committees and or support from special interest groups.
And are you?
No, I am not.
Okay.
As the only hunter and farmer running for this seat, I was not able to take the endorsement or offered the opportunity for the National Rifle Association, which was fine. But the question is for Brenda, because she was endorsed by them. And in their questionnaire, they're adamant about their desire to allow fully automatic weapons available to the public for use. I'm wondering, what pledge did you make on that issue when you filled out that questionnaire to get the endorsement, and what pledges have you made to that organization other than that?
And we'll have to keep your response fairly brief so we can move on to one
I
more
agree,
issue.
Brief. I'll tell you what, it's the same questionnaire that was offered to all the candidates. My understanding is that it was offered to all candidates, and they all had equal opportunity to respond. So the organization is out there and willing to support any candidates that are willing to answer the questionnaire. And I think that's the key is are you taking the time to look at these other organizations? And I find it interesting, actually, that you're saying that you don't take that, because in your 2005 and 2006 campaign finance reports, it shows that you did take PAC and lobbyist money.
No, that's not correct.
Well,
Okay.
it's on the website for campaign finance.
And you have a website as well?
That's correct.
Okay,
Yes.
Tell us that briefly.
That's at Kelleher for Senate.
Okay, so perhaps more information on this issue if you want to further investigate. Question for one of your opponents.
Okay, just one or for each one?
Oh,
we'll come back around to
permits, just one right now,
okay.
Yes.
All right, okay. Well, I would ask this question to Brenda.
Very good.
There's a Senate, a majority of the senators right now are Democrats. And we're expected to pick up more Democratic seats, even strengthening the majority. And being a minority member, how would you, it's going to be very difficult to serve southeastern Minnesota and have your voice heard. Could you explain or address that, please?
Well, I think that we've had good representation already from Mr. Gene Pulowski, even though he's been in the minority, and also Bob Curlin, Senator Curlin, even though he was in the minority in the Senate. The key to it is knowing how to work in a nonpartisan way, in a grassroots kind of way, and that's what I've been doing in southeast Minnesota for over 8 years now, working with all legislators. And in fact, when Bob Curlin decided to retire, it was legislators across the board who said, Brenda, I hope that you will run, because what you've done in southeast Minnesota, getting legislators to work together, is going to be very important for the entire southern Minnesota area. And I want to make sure that our district is right at the heart of that, because the I-90 corridor group is brand new. It's still in a formative stage, and I would very much like to have our district be at the heart of that, because we're rural, we're small towns, and we need to have a strong voice by linking it with other legislators.
I need a 1-minute response from each of you. Prescription medication prices. Can you encapsulate in 1 minute a solution to this big issue for a lot of our senior citizens? Why don't we start with you?
I have an
1 minute.
I have an 18-point plan, and that pertains to reducing the cost of health care. I also have a 6-point plan for reducing the cost of health care insurance. And frankly, those don't fit into a 1-minute response.
Right.
But we do have a lot of things we need to do within the state for all of our health care issues. However, I'm not a fan of the single-payer plan. I know that there's a plan in Ohio in particular that would be wonderful for us to use for our prescription cost issues, and so that's the one that I would be looking for, and that's part of one of my points for one of my plan points.
And for more information, go to your website to learn all about your views on this issue. Kevin.
It's always interesting in the election year, everybody has a plan. And then when we get there, we have 9 special sessions in 12 years and government shutdowns. But nonetheless, on this specific issue, I find it very interesting that we have politicians actually running on their support of going to Canada to get prescription drugs. And I think there's a problem with that. I think there's a problem with healthcare in general. I think all 3 of us would agree to that. I think we all have separate ideas of how we want to approach that.
It's a complex issue.
Yes, and all of us really, we can say we're experts or whatever, but quite frankly, we'll have to work on a lot of different issues. But that's an issue that I will sit down with other legislators and we'll work that out. To me, have a minute to tell you how we're going to do it.
Right. And thus a website. If people want more information, they can go to the website. Sharon.
Okay. Well, I have been a registered nurse for 30 years, and I understand firsthand that people are just struggling with health care costs right now, and prescription drugs is certainly one of them. You heard me talk earlier about a statewide pool. If we get to the point where farmers are self-employed or people can roll into a statewide pool, we will have tremendous buying power for the state of Minnesota. And Kevin mentioned Canada. The reason Canada is able to negotiate down their drug prices is because they have such a huge pool. And in fact, Minnesota could capitalize on some of that same tremendous negotiating power. We could negotiate down our costs by billions of dollars just in Minnesota. There'd be tremendous savings for people living here. And it would be good for small business. It would, small business is really hobbled with the healthcare costs, trying to cover their employees. So I plan to contain nursing home costs, negotiate down our prescription drug prices, and we also need to address the nursing shortage. There's 3,000 nurses that are short in Minnesota. So we have a lot of issues to deal with. Minnesota's biggest crisis right now is healthcare, and I'm the healthcare candidate.
All right. Well, can you believe a half an hour has almost passed? Again, I want to offer our viewers, if you want more information on these candidates, you can go to their websites. Again, briefly, your website again, Sharon.
Is ropesforsenate.com.
Okay, Kevin?
www.kelleherforsenate.us.
Okay. And
BrendaJohnson.org. And we'll talk more about how you're going to raise the taxes to pay for your education plans.
Very good issue. Yes, thank you very much. And we appreciate you for being with us today, candidates, and we wish you all the very best. Of course, voting is one of the key ways that you have for staying very actively involved in the decision-making process in this country. So we encourage you to exercise this right, get out and vote on November 7th, a big day. You have big plans for that day?
Absolutely.
Yeah, where will you be, by the way?
I'll be with the Winona County DFL.
Okay, Kevin?
I'll be getting some sleep.
Oh, good for you, Brenda.
I'll be doing a lot of activities starting in the morning and going through the whole day visiting communities.
Okay, thank you for joining us today. And there's more great programming coming up on KSMQ. For KSMQ and KTTC, I'm Tom Overlay. Thank you for joining us today.
Thank you.
Thank you.
Thank you.
Okay.
Just hold on for a second. Just hold on. We're still...
That went along very quickly.
Isn't it?